this is my patient. Her initials are NS, and today my name's Danielle. I'm going to be her nurse. So right now we're going to be doing a head-to-toe physical exam, and I'm just going to go ahead and close the curtain and make sure we have privacy. And then I'm going to go ahead and wash my hands over here. And I'm going to check for safety with my patient. She has her call bell over here. Her bed is in, well, her chair is in normal height. And she has her call bell and she is safe and we are ready to go. Are you ready for an exam?
Yes.
Okay. All right. So we're gonna start with your head, eyes, everything on your head. See if anything's going on. Are you having any problems there? Any pain?
No.
Okay. So I'm gonna go ahead, I'm gonna put gloves on. And then I'm gonna go ahead and I'm gonna look at your scalp. I'm just gonna inspect the head, make sure there's no abnormalities or lesions, no parasites. I'm checking the back of the head. Everything's normal. Just a little greasy. All right. So your scalp looks good. And the next thing we're gonna do, I'm gonna look at your eyes. Do you wear glasses at all?
No.
Okay. So I'm just gonna look at me, and then I'm gonna just look straight in my eyes. All right, normal reaction. Another normal reaction on both your right and left eye. Your pupils dilate to light, which is normal. All right. And then I'm just gonna have you follow my light. Okay, so you're just gonna look at it. Don't move your head though, just move your eyes. All right, normal for that. Have you had any trouble reading, seeing, nearsighted, farsighted, anything like that?
No.
I'm gonna go ahead and look at your ears. I don't have an otoscope, so I'm gonna use my nursing pen light. With normal redness. Any itching or anything going on?
No.
Back of your ears. All right, and I'm gonna go ahead and go over to your right ear. Looks normal, nothing going on there. Okay. And then next, I'm gonna go ahead and look at your mouth. So I'm gonna need you to open up your mouth. And I'm gonna have you stick out your tongue and say, ah, ah. Okay, normal response with that. Look at your teeth. Any trouble going on in your mouth?
No.
All right, good. The mouth looks normal. It's moist, it's red. The teeth look good, nice and white. Making sure you're brushing your teeth every day. All right, and I don't have anything to put in your mouth, but I just want to explain the gag reflex a little bit if you ever have it. It's just to help prevent choking or swallowing something poisonous. Okay, so we did that. That's your head exam. So next I'm going to go on to do your lung exam. So I'm going to listen to your lungs. I'm going to look at your chest. All right, so when I listen to your lungs, I'm just going to have you take a deep breath for me. Okay, one down. Just another normal deep breath. Those are both clear. I don't hear anything going on there. So I'm just going to have you lift up and I'm going to listen to their back sounds. Normally clear in the left upper lobe. Normally clear in the right upper lobe. Now I'm doing your right middle lobe. Another deep breath. Clear for the right middle. Next, I'm going to go over down to your right lower lobe. Nice and clear. I'm going to go over to your left lower lobe. All right, nice and clear with those. You can sit back. All right, so just breathe normal for me. Chest expansion is normal. Will you sit up for me? And just take another deep breath. I'm just going to look at your chest expansion from the side. All right, so your left is normal. I'm going to go over to your right side and look at your chest expansion. All right, looks good, symmetric and even. All right, so I'm gonna put my stethoscope on your middle sternum, and I'm just gonna have you say a word for me. I'm checking for tactile firmitis. So I'm gonna put this here, and I'm just gonna have you say 99.
99.
Okay, and again.
99.
Yeah.
99.
All right, sounds normal. Tactile firmitis is normal. All right. Have you had a cough recently?
No.
All right. Okay, so I'm gonna just percuss your lungs. So I'm just gonna have you sit up again. All right, and on your left upper lobe, I'm just gonna percuss. Okay. And then your right lower. All right. Those are all normal, they're all resonant. So I hear no dullness, which is good. That means there's only air in your lungs right now. I didn't hear any water. All your lung sounds sounded good, so nice and clear. All right, so we looked at your chest, very symmetric. I'm gonna look at your neck. We're not having any problems with your neck?
No.
Okay. So I was looking for jugular venous distension, which she doesn't have. All right, I'm gonna have you show me both your hands. Okay, so I'm looking at her hands to see if she has normal capillary refill. I'm gonna press down on each fingernail. All right, on the left side, her color's coming back right away, so she has good capillary refill, less than 2 seconds. And then on the right, capillary refill is normal on that, less than 2 seconds. And I don't see anything pallor or anything going on. All your nails, everything looks like normal colors, no clubbing. It looks good. All right, I'm gonna take off your socks just so I can look at your feet.
I'm gonna take them off.
I take them off. I know it's hard to see on the video, but we're gonna look up. I'm gonna check your ankles. No edema on the ankles, so that's good. I'm gonna check the capillary refill on her toes. Normal capillary refill, less than 2 seconds on her toes. I'm gonna take a pedal pulse. All right, pedal pulse is felt, it's normal. Can I check the bottom of your foot? All right, her left foot is normal color, no edema. All right, put this sock back on.
Sorry about my long toenails.
All right, and then we're gonna check the other foot. Lift up. All right, so I'm gonna check out the ankle. No edema in the right ankle. Checking capillary refill of the right toenails. All right, everything's normal, less than 2 seconds. I'm gonna check the pedal pulse. All right, normal regular pedal pulse. You're gonna have good pulses down there and good blood flow. All right. We did our respiratory evaluation, we did our head evaluation. Now we're gonna do the cardiovascular. In this, I'm going to be listening to heart sounds. So the first is the apical pulse, which is the 5th intercostal space, and I'm going to listen to that for 1 full minute. I'm going to find your 5th intercostal. And 5. And I just need you to breathe normally for about a whole minute. Check my watch. It's been about 1 full minute. Regular heart sounds. It's 65, so it sounds good. Have you ever had any trouble with your heart?
No.
All right, so I'm gonna listen to all your heart sounds now. So that was the apical pulse. And next I'm gonna listen to your aortic heart valve, which is on your second right intercostal space. I'm just listening for abnormal heart sounds. We're hearing a 1, 2, and it's right on the border, so I'm gonna do here. You just breathe normally. Alright, sounds good. The next one is going to be the pulmonic, which is at the left sternal border, at the second intercostal space. I'm going to find 1, 2, and put it here. Listen for any more. Okay, sounds normal. And then next we're going to go to the tricuspid, which is the 4th intercostal space on the left side. 1, 2, 3, and 4. Alright, sounds normal. And then we're going to go down to the 5th intercostal space and listen to the mitral. Okay. I hear no adventitious sounds, which is a good thing. I'm going to go to your carotid pulse. I'm going to listen here. Just check for the pulse. Okay, and I'm going to use the bell of my stethoscope and I'm going to listen to the bruit. Alright, sounds normal. And then we looked at your feet, you have normal pulses, and check your radial pulse. Alright, radial pulse is normal on the left. I'm going to go to your right. Radial pulse is normal there. Can I see your brachial pulse? Alright, normal brachial pulse on the left. And then on the right. Normal brachial on the right. Alright. And then next we're going to go to your gastro. So we're going to listen to your stomach. Have you had any issues with your stomach?
No.
Alright. So first what I'm going to do is I'm just going to look at it. It looks normal, symmetric. No bruising, lesions, or anything.
Nope.
And then I'm going to listen to it. I'm going to listen for each 1 full minute. And I'm listening for normal bowel sounds. You have normal bowel sounds on your right lower lobe, or right lower quadrant. They're between 5 to 30. I'm going to go up to your right upper quadrant and listen. also normal active. I'm gonna go over your left upper quadrant and listen. Okay, normal active, and then last one is your left lower quadrant. Okay, we're normal active, that's good. So everything's normal active, sounds normal. All right. And then normal active is between 5 to 30 vowel sounds in a minute. Okay, so next we're gonna percuss your abdomen. So I'm just looking for any resonance in areas that it's not supposed to be. It's gonna be a little more dull up here because on your right side is where your liver is. We can only feel a little bit of it, but we should only be able to feel a little bit of it. And over here, your spleen is on your left side. All right, sounds normal. I'm just gonna palpate. Tell me if you feel any pain.
No pain.
There, we shouldn't be able to palpate your spleen. Just tell me if you feel any tenderness. I'm gonna feel on this side. Just tell me if you feel any tenderness. So she was non-tender there. You shouldn't be able to feel the kidneys, but she was non-tender, so it doesn't seem like there's anything wrong with her kidneys. Okay. So next we are on the musculoskeletal part of the exam. I'm just gonna look at your skin. We're gonna look for any swelling around. Do you have any areas where you have swelling, any muscle accidents, anything with your skin or any? Nothing. Okay, so stick out your arms for me. Okay, everything looks good. And this one. Right and left side skin look good on both arms. I'm gonna look at your neck. And while we're here, I'm gonna test range of motion in your neck. So I'm gonna need you to take your neck and move it from one shoulder to the next. Okay, and then turn your head from side to side. Okay. Now I'm gonna take your chin and drop it to your chest. Does this hurt at all?
No.
Okay, you can lift it back up. Looks like nothing's wrong with the neck, it looks good. You show me your hands. I'm gonna look at your knuckles. Any swelling, inflammation, pain from your knuckles?
No.
Anything in your wrists?
No.
Everything feels normal, no redness, no heat.
No.
Looking at your elbows. Everything feels and looks normal. Can you go flex your wrists for me, both up and down? And then can you take your wrists, take your palms, all right? And then I'm gonna inspect your elbows. So I'm gonna have you lift your elbow up, all right? So your right is normal, you do it with your left. Any pain when you do that?
No.
All right. And then your shoulders, can you lift both shoulders up for me? They look even, symmetric. I'm looking the back. Everything looks even and symmetric with her shoulders. No pain. Can you lift one shoulder? Your right shoulder. Can you lift your other left shoulder? Okay. And then we're gonna look at your arms. So what I'm gonna have you do is I'm gonna test for adduction and abduction. So I'm gonna have you lift your both arms up. All right. Adduction is normal, and then lift them both back down to your sides. Abduction is normal. All right, abduction is away from your body, and then adduct is to your body. And then I'm gonna have you lift both your legs up. All right. And then can you take your feet, and I'm gonna have you push against my hands, so lift them up, lift your feet up, and push against my hands as much as you can. All right, strength is good. And then I'll have you do the same. You're gonna lift your arms, try to push against me. Okay. And then I'm gonna have you squeeze both my hands. All right. Normal grasps. normal strength. Nothing seems like it hurts or is weak or anything. Okay, so now I'm gonna have you stand up. And then, do you have any trouble with your spine?
No.
Okay, so I'm gonna have you stand and go as far back as you can with your spine. And tell me if you feel any pain.
No.
All right, you're good. You can stand. All right, you can sit back down. So spine is normal. All right. So now I'm going to be testing your reflexes. So what I'm going to do is I'm going to hit this against your knee, and we're just going to test your reflexes there. Okay. All right, normal active reflexes. Again. All right, normal active. Lift your arm up. So I'm just going to hit against here. Okay. All right, normal active reflexes for both her right arm, and right leg and left leg on her knees. Oops, there goes that. So I'm gonna do a little test on her skin. So this is kind of musculoskeletal, but also neurological part of the exam. So I'm gonna have you close your eyes, and you're gonna tell me if the feeling is either sharp or soft on you. Okay.
Okay.
All right, so I'm gonna go to your left arm. Tell me what you feel.
Soft.
Okay.
Soft.
Okay, and go to your right arm.
Soft. Soft.
All right. So normal sensation in both arms for soft. And then next, tell me what you feel.
Soft. Soft.
You don't feel sharp at all?
Sharp now. Sharp. Sharp.
All I have is a Q-tip, so it's hard.
Sharp. Sharp.
Okay. So her sensations are normal in her arms. It's just that I have a Q-tip. I don't have anything very sharp. All right. So I'm gonna do it to your legs too. So tell me what you feel.
Soft. Soft.
Okay. And then next line.
Soft. Soft.
Okay. Next one.
Sharp. 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 Sharp.
Okay, so she has normal sensation in both her bilateral lower extremities and her upper extremities. So next, I'm gonna have you close your eyes. I'm gonna take off your socks, and I'm just gonna have you tell me when you feel something touching your foot, okay?
Okay.
All right, so lift up. I'm gonna do it on the bottom, so close your eyes and just tell me if you feel, when you feel something.
I feel it on my toe. On my foot. I feel it. On my heel.
Okay, I'm gonna just leave this off for now because we're gonna go back to your feet. I'm gonna take your other one, and have you close your eyes and just tell me when you feel the sensation.
I feel it on my toe. Feel it in the middle of the foot. On the heel.
Okay, so it looks like normal sensation in both your feet, which is good. No history of diabetes for you or anything in your family?
Nope.
All right. So we tested your reflexes. We did a soft test with a sharp test. And so next I'm gonna have you stand up and we're gonna look at how you walk. So I'm just gonna have you can walk towards the camera, yep. All right, and then back towards the camera. Normal gait, it looks like nothing's going on. Does it hurt when you walk or stand?
No.
All right, so you can go ahead and take a seat. So next I'm just gonna ask you a few questions. It's just to test your neurological, to see, how your memory is. So I'm gonna tell you 3 words. It's bed, sock, and blue. Can you repeat those to me?
Bed, sock, and blue.
Okay, so remember those words. Do you know what today is?
Sunday.
Okay. Do you know the month?
December.
Do you know the year?
2020.
Okay, and can you repeat those first 3 words to me?
Bed, sock, and blue.
All right, so you are alert and oriented. I would say ×4, you know where you are right now.
Yes.
Okay. And then I'm just gonna ask you a couple questions. Do you have any concerns about anything going on with you?
No.
Anything we went over that you want me to take a look at again?
No.
Okay. So what do you do to keep yourself healthy?
I exercise and I eat good.
Okay. You also said something about you meditate sometimes. Does that help with stress?
Yes.
Okay. Do you ever go out and drink?
Yes.
Okay. Do you see yourself, is it kind of socially drinking?
Yes.
Is it like more than 2 or 3 times a week?
Yes.
Okay. And do you find it hard to just have one drink when you drink?
Yes.
Okay. Do you think it's just partying, or do you think it's sometimes to cope with stress?
To cope with stress.
Okay. So maybe we'll try to see if we can help you cope with stress a little bit with all those. But I think that's all we have for today. The exam's over. Everything, you look really good, really healthy, so I would just keep up the exercise and the eating well. But I hope you have a nice day.
Such a good nurse.